So part 2, today we will discuss about back stretches. So we will see about teres major muscle. So it originates from the lateral 1/3 of the dorsal surface and the inferior angle of the scapula. It inserted into a bicipital groove of the humerus. Its action is medial rotation and adductor of the arm. So ask the subject to sit in a comfortable manner and ask to touch the other side of the shoulder. And on the other hand, slightly hold the doing hand, so slightly pull your hand and then feel the teres major muscle stretch. Maximum level of stretch is seen on 15 seconds to 30 seconds hold. So we will see about supraspinatus muscle. It's originate from the supraspinous fossa of the scapula and inserted into a greater tubercle of the humerus. Its action is 15 degree of abduction. Ask the patient to stand in a comfortable position and turn. And ask the subject to do the maximum level of adduction, and on the other hand slightly pull over the stretching hand to feel the maximum level of stretching supraspinatus muscle. So next we will see about rhomboides major muscle. It originates from the lower part of the ligamentum nuchae and then spinous process of C7 and T1. It inserted into a spine of scapula and its action is retraction of the scapula. To do the maximum level of stretching, ask the subject to stand in a comfortable position and do the maximum level of stretching. So comfortable position, clasp both the hands together, slightly pull forward and feel the maximum level of stretching and then relax to your original position. So next we will see about subscapularis muscle. It originates from the medial 1/3 of the subscapular fossa of the scapula and inserted into a lesser tubercle of the humerus, and its action is maximum adduction and extension. Ask the subject to stand in a comfortable manner and hold, and ask the subject to do the maximum level of abduction with flexion. On the other hand, holding their stick and extend and flex to the maximum level of stretching. And then get back to original position. So next we will see about latissimus dorsi muscle. It originates from the inferior angle of scapula and then thoracolumbar aponeurosis and iliac crest. It's inserted into a bicipital groove and its action has the internal rotation, adduction and then extension of the arm. Ask the subject to stand in a comfortable manner to do the maximum level of abduction, flexion, and on the other hand holding the stretching hand to feel the maximum level of latissimus dorsi stretch and relax to bring back its original position. So next we will see about Ectospin muscle. It originates from the lumbar and thoracic region. It exactly T11 and T12. It inserted into a spinous and transverse process of the vertebra. Its action is extension of the vertebrae. Then to do the maximum level of erectospinal stretching, ask the subject to sit in a comfortable manner and do the half kneeling method. And then quadruped position and then half sitting position to do the erectospinal stretching. To feel the maximum level of erectospinal stretching, to hold this position for 30 seconds and relax and bring back its original position.